was a very slender child, was active in sports, cheerleading, dance. Going into even high school was absolutely fine. When I went away to university or college, I was experiencing food that I wasn't used to because I was in college and eating at the dorms and that sort of thing, dealing with being away from home. And I started eating my emotions. It was just a vicious cycle that as I would gain more weight, I obviously wouldn't feel that great about myself and would just eat more. And so just kept putting on the weight, putting on the weight. It was probably around 350 pounds for a good 20 years. The doctor said, have you thought about doing the gastric sleeve? I was one of those people that said that's the easy way out. I don't want to have it done. It's cheating the system. It's all of that. But as we talked about it more, I realized that I felt like I had tried absolutely everything and nothing was working. And it might be time that I needed to do this. And so we decided that I would have surgery to get my gallbladder removed and my gastric sleeve. So I was 150 kilos. I went down to my lowest weight, which was 84 kilos. So then as I lost the weight, obviously it was a large amount, I started having extra skin. And I had extra stomach skin, I had extra arm skin. My breasts were very, very, hung very, very low. There was skin between my knee, my legs, my back, everywhere. And I was to the point where I was exercising with a trainer, basically 6 days a week, 2 hours a day, was very, very fit, was able to do almost anything in the gym. I could run, lift weights, all that sort of thing. But what I was having to do was wear the tightest sports bra possible. I had extra skin under my arms that would rub as I exercised. I had no volume in my chest, basically. And so it was just skin that I was trying to hold in while I was exercising. Not only was it uncomfortable, it was embarrassing. I'd done all the work mentally, but I needed to physically be the same. And so that's when I started thinking about cosmetic surgery. Came to see Dr. Ali and thought, okay, what are my options? What can I have done? And then I saw the pictures of what was possible. And at that point, I was ready to go. Again, I wanted all my hard work to reflect in the body that I saw when I didn't have my clothes on. I needed that final piece of self-confidence. And so we then decided to do two different stages. The first stage was to do the bottom, a belt lipectomy. And then 6 months later, I did the top, where I did my arms, my breasts, and my back. The first surgery, it took a good 2 months to feel like 100%, or just feeling like I could get back into myself. I had my second surgery 6 months later. By then, I was fine. I wore my compression garments probably longer just because I wanted to make sure that everything was working well. So I wore them for about 6 months each. The second surgery was much easier and the recovery time was easier, but that's because it wasn't as extensive as the first one. As I recovered, everything was fine. I was very, very fortunate. I didn't have any problems. I had no complications. Everything is healed really, really well. It was life-changing. It changed my entire confidence level. I didn't necessarily change in size as much as I thought I would, which was fine because I was very happy with my size. One of the questions that Dr. Ali asked me was, do I want to look good in clothes or do I want to hide the scars? And I chose I want to look good in clothes. Actually saying that, you can't even see my scars anymore. Since then, since the surgery, like I said, it completely changed my confidence level. I could exercise and not have extra skin everywhere or feel like I had to hold in all the extra skin. I looked good in a swimming suit. I could wear a bikini again and feel confident. And that was something that I hadn't done for 20 some years. It's just like if you had some other sort of illness, you've got to see specialists. It is important that you talk to people that are used to dealing with bariatric surgery, used to dealing with after cosmetic surgery, used to dealing with that sort of thing, so that they're going to give you the best care possible. For me, the success I feel after my surgeries where I wore the compression garments, I followed what the doctor said. I made sure that I was, taking care of myself. I took care of my skin. So my life now, and since the sleeve, and then, probably mostly since the plastic surgery, the cosmetic surgeries, is completely different. I now can wear leggings to the gym and normal undergarments or panties and bra underneath. I can go to normal stores and wear and buy bras. I don't get nervous going onto an airplane thinking, oh, I'm not going to fit in the seats anymore. And I can try any exercise that I want, and I can wear sports clothes. I wear bikinis now where I never did that before. I can have relationships. I can feel comfortable if I'm taking my clothes off. I had energy and I could keep up with the daily demand of a job where when you're 350 pounds or 150 kilos, you're tired all the time. I really wish I had done this years and years ago, because in a way I feel like I've lost some years of my life. It's everything that you don't even think about when you're skinnier that you now can do, whereas you couldn't do that when you were heavy.